So the final thing that we're going to talk about is going to be the treatment of heart failure. And what we need to talk about are the common classification systems that are used. And so the first one is the New York Heart Association Functional Classification. And the second one is the American Heart Association / American College of Cardiology classification. And so the difference between the two is that the New York Heart Association is based on symptoms, while the AHA-ACC is more focused on the progression of the disease. And so now let's go through the different stages. New York Heart Association is classified from 1 to 4, and the AHA-ACC ranges from stage A to D. And so in stage 1 of New York Heart Association classification, you have no limit on exercise and no symptoms. In stage 2, you have a decreased exercise capacity and you have symptoms that become present upon normal exercise. In class 3, you have more severe limitations on physical activity, and you have increased symptoms at less than normal exercise. And finally, in class 4, you have symptoms that occur at rest. In the AHA-ACC classification, in stage A, this is really just the person that is at risk. They have no structural disease and no symptoms. In stage B, they have structural disease now, but still no symptoms. In stage C, they have structural disease and now have developed symptoms. And finally, in stage D, they have structural disease as well as symptoms, but the condition has become medically refractory. These two classification systems are not mutually exclusive, and different stages in the New York Heart Association can correspond to different stages in the AHA-ACC classification. And so Class 1 and Class B are generally associated. Class 2 and 3 correspond to Stage C in the American Heart Association and American College of Cardiology classification. And finally, Class 4 and Stage D correspond to each other. Now, these classifications are very important to understand because patients are classified based on either their symptoms or structural disease or the progression of their disease, and treatment is based on where they fall in these classification systems. And so we'll show this later as we go over the actual treatments for the disease. So let's move on. So what I've done here is listed some of the mainstay therapies for heart failure. And so we're going to go through a very simplified mechanism of how these drugs work. So ACE inhibitors, which stands for angiotensin converting enzyme inhibitors, or ARBs, which are angiotensin receptor blockers, both act to decrease afterload. They do this through inhibition of something called the renin-angiotensin-aldosterone system. They both have a similar action but act at different points, and generally the indication for an ARB over an ACE inhibitor is when ACE inhibitors are not tolerated due to a chronic cough that they cause. Beta blockers inhibit the sympathetic system, and while they do many other things, I think it's beyond the scope of what we're talking about here. Diuretics will increase the sodium and water excretion. Aldosterone antagonists will decrease the reabsorption of sodium, thus increasing its excretion, along with some water, and act somewhat like a mild diuretic. Digoxin acts through inhibition of the sodium-potassium ATPase, specifically on cardiac muscle cells, to increase calcium, which will then increase contractility, which we've talked about previously, and this is also known as inotropy. Now, inotropic support is used primarily in two types of therapy, one being bridging therapy, when you're waiting for placement of something such as a ventricular assist device or a heart transplant, or during hemodynamic instability in cases such as acute heart failure. The main difference between digoxin and inotropic support is that digoxin is really used in chronic heart failure. Inotropic support is used more acutely and for bridging therapy. Now, heart failure is treated in a stepwise fashion, meaning that as a patient progresses through the different stages of heart failure, different drugs are added upon drugs that were prescribed in earlier stages. So we're going to draw a staircase here and show you how this works. And this will be stage A, B, C, and D. And so in stage A, remember, since these are patients at risk, we really just control their risk factors like obesity and other comorbidities such as hypertension, diabetes mellitus, and coronary artery disease. In addition, there are certain patients that can be placed on an ACE inhibitor under the right circumstances. And an example of an ACE inhibitor would be lisinopril. And this class of drugs typically ends in opril. In stage B, now all patients will be on an ACE inhibitor, and select patients will be on a beta blocker. And an example of a beta blocker would be something like carvedilol. And this class of drugs typically ends in lol. In stage C, you have to remember that this is the first time that we have symptoms. And so on top of everything that we've previously used, we're going to treat the symptoms. And so all patients here are on an ACE inhibitor and a beta blocker. But now for symptomatic relief, we also use a diuretic. And an example of a diuretic would be something such as furosemide. This is also known as Lasix. We can also add aldosterone antagonists in this stage. Something such as spironolactone. We can add digoxin. And in select patients whose ventricles are not contracting at the same time, we can implant an ICD, which is a defibrillator, or a CRT, which is a resynchronization therapy device. One thing I'd like to point out is that we really don't have great treatment for diastolic heart failure, and so most of these apply to systolic heart failure. But what we can do in patients with diastolic heart failure is we try to relieve symptoms with something such as a diuretic, and we try and maintain quality of life, and we manage the patient's comorbidities such as hypertension, coronary artery disease, and diabetes mellitus. Stage D is pretty much end-stage heart failure. And so in this stage, you have talks of palliative care as well as hospice. Another option that patients have is heart transplant, or something that is a little more temporary, such as a ventricular assist device. So now you have an idea of the different classification systems used to categorize patients with heart failure, and knowledge of what drugs are used based on where patients fall within the classification system of heart failure.